In this segment, we're going to discuss the normocytic anemias. And usually, normocytic anemias, they are less frequent than microcytic and macrocytic. Acute blood loss anemia is a normocytic anemia. Aplastic anemia, anything that stops the bone marrow from functioning, whether you destroy the bone marrow by drugs or radiation or autoimmune process. Hemolytic anemias, the typical examples of normocytic anemia, like sickle cell anemia, and early phases of anemia of chronic disease, very early. But again, I repeat, for the sake of the test, whenever I say anemia of chronic disease, I mean microcytic. Aplastic anemia, if the bone marrow is destroyed by whatever process, you're going to get pancytopenia. All cellular elements will go down. White blood cells go down, platelets go down, red blood cells go down. So failure or suppression of bone marrow to produce blood cells. Aplastic anemia could be idiopathic, we don't know why, or could be induced by chemicals, drugs like an old antibiotic, chloramphenicol, used to cause this aplastic anemia. If it is slowly progressive, we call it hypoplastic anemia. And the treatment can be blood transfusion or even bone marrow transfusion, bone marrow replacement. Post-hemorrhagic anemia or acute blood loss anemia. Here, the danger of hypovolemia is more than the danger of acute anemia. So you have to replace the volume by crystalloids, colloids, or even blood. And I think this concludes this segment. I want to mention one information about cyanosis here. I think I have one of these questions is considering cyanosis. Let me okay. Anyway, there is one question about cyanosis. Let me highlight this using the whiteboard. Cyanosis. We call it central cyanosis when it is in your tongue, mucous membranes, and fingers and toes. We call it peripheral when it is only in your fingers and toes. Okay. So central cyanosis means what? Central cyanosis means less oxygen in your blood, hypoxemia. Now, what carries oxygen in your blood? It is hemoglobin. And the hemoglobin exists in two forms: oxygenated and deoxygenated or less oxygenated. So usually the arterial blood has oxygenated hemoglobin. The venous blood has less oxygenated hemoglobin. The more the deoxygenated hemoglobin, the more the risk to develop cyanosis, right? So what is the amount of deoxygenated hemoglobin that results in cyanosis? And the answer is you need at least 5 grams of desaturated hemoglobin to develop cyanosis. And it is an absolute number, 5 grams. It's not related, it's not like percentage of your hemoglobin. It's 5 grams. Once you reach 5 grams desaturation of hemoglobin, you become cyanosed. So let me give you examples of 2 patients. Patient A has a hemoglobin level of 20 grams. Patient B has a hemoglobin level of 7.5 grams. So obviously patient B has severe anemia and patient A has polycythemia. In order for both to have cyanosis, cyanosis will occur in both when both have 5 grams desaturated hemoglobin. In patient A, 5 grams out of 20 is only 25. So patient A, just with 25% hemoglobin desaturation, will develop cyanosis. But in patient B, the 5 grams out of the 7.5 is 75%. So to have 75% desaturation, this means you must have very severe hypoxia to have this extreme desaturation. And this means the more hemoglobin you have, the easier to get cyanosed. The more hemoglobin you have, the easier to detect cyanosis. So if an anemic patient looks cyanosed, this is very serious. This is very dangerous because this means a big percentage of his hemoglobin is now desaturated. And this should be the end of the blood lecture.